Courtenay-Alberni.
Madam Speaker, I'm here again tonight. We've now lost 47,162 people to poison drug supply. That's between January 2016 and May of 2024. Madam Speaker, that's more people lost than we lost in World War II. Yet we're not seeing a war-type effort, Madam Speaker, to save lives in this country and to fight this crisis. We've heard, from the experts, Madam Speaker, from the First Nations Health Authority, the Canadian Association of Chiefs of Police, the Chief Medical Health Officers of both British Columbia and Ontario, the Chief Coroners of both provinces, where the highest amount of deaths are happening in Alberta, BC, and Ontario. The Canadian Expert Task Force on Substance Use that was made up with a wide spectrum, including law enforcement, and Mom Stop the Harm, the Canadian Medical Health Association. Madam Speaker, what we've heard is they've been consistent and unanimous in saying that we need to stop criminalizing people who use substances. We need to replace the toxic street supply with a safer supply of drug replacement therapy, that we need to have treatment on demand, no-wait treatment, Madam Speaker, no-wait stabilization beds so that when people want help, that they get help, that we invest heavily in recovery and prevention, focused at our youth, Madam Speaker, and of course enforcement, so that law enforcement can go after the manufacturers of the substances and those that are trafficking, especially those at the high levels. But Madam Speaker, most importantly, all of them have said we need to treat this crisis like the emergency that it is. The government has spent less than 1% responding to this crisis, Madam Speaker, than they did COVID-19. Why? Because of stigma. That's exactly why, Madam Speaker. We know who's dying, mainly men. When you look at my home province, you're 5.9 times more likely to die if you're First Nations. In Alberta, it's 8 times, Madam Speaker. The new Chalmers Tribal Council in my riding just declared a state of emergency. They're losing so many people, so many members, Madam Speaker. The nation of Howsett has lost over 100 members because of the mental health and substance use crisis just in the last few years. I know many of them. It's very painful to see what's happening. Also, the big city mayors have been calling for help, Madam Speaker. They're saying that not enough resources are being applied to respond to this. We've seen countries do this, Madam Speaker. Portugal saw a 77% drop in chronic daily users because they got the politicians out of the way. That's what we need to do. We need to support the experts with evidence-based policy and provide the resources. But Madam Speaker, this government, they put forward their drug strategy, and it's great. It meets all the same language that we see in Portugal, a compassionate, coordinated, integrated plan. But guess what it's missing, Madam Speaker? No timeline and no resources on how they're going to respond to the crisis. They've had an auto theft summit, Madam Speaker. Not saying that's not an important issue, but they have still not had a summit on the toxic drug crisis. Madam Speaker, the Substance Use Assistance Program on Vancouver Island, only one riding. Victoria got funding. Everybody else got shut out. Nations that needed that money, Greater Waterloo region, my colleague was saying, got nothing. Madam Speaker, we need action. We need this government to treat this with the war effort that it requires. Nobody is not feeling this right now. Nobody, no community is being left, Madam Speaker. This is what I would call an emergency, and this government's not treating it like that.